So I haven't done a video in a few days, and there's a pretty good reason for it, I promise. I'm having to be kind of quiet because it's late and Sam's asleep in the next room. So, why I'm in the bedroom and not elsewhere. But anyways, so to give you a quick rundown of the last couple days, Tuesday, I don't know if I mentioned it before in a previous blog. I feel like I say that in every blog, in every one of these videos. My memory being what it is, I legitimately cannot remember. So, I don't remember if I mentioned it in a previous video, but Tuesday I called my doctor back. I had to go in for the blood work last week. Called my doctor back on Tuesday because I was having some new symptoms. Tuesday was pretty bad for me, guys. I couldn't lift my arms much at all. My sister, thank goodness she was already coming over because she had to, I couldn't even brush my own hair. She had to brush my hair for me and put it back in a braid to keep it out of my way. And I was so fatigued. Just lifting my arms felt like I was doing deadlifts in my shoulders and upper arms. So it was pretty bad. The fatigue was pretty bad. We consequently had to do her baby registry that day. So I ended up going, but I was wheelchair bound. Something I'm going to have to do tomorrow too, because we're going to finish her baby registry tomorrow, or at least go to another store. We only did one store for hours, but, you know, whatever. I understand the benefit of having multiple stores on your registry. Anyways, so I didn't hear back from my doctor until Wednesday. And she called and was like, with your new symptoms especially, we need to get you into an MRI, like, yesterday. So they got me into an MRI for the next day, which was Thursday. We managed to just fit it in an hour before our OT appointments started. So we got to OT a little bit late, but ultimately was able to make all of our appointments because the neurologist office was only about 13 minutes away from the OT office. So, big city you live in. Anyways, I had an MRI. It was the first one I've ever had. It was extremely disorienting. I have to unfortunately have more MRIs. So probably ones that'll last even longer. This one lasted about 30 minutes. It was fine. Pro tip though, go to the bathroom before you get in the machine. Holy crap. Go to the bathroom before you get in the machine. Just take my word for it. But you do not want to have to sit there for hours and have to pee the whole time. Fortunately, I wasn't in the machine for hours. I was only in for about half an hour for this one. But they were looking for MS lesions. They did not find any. I will say, however, that they have to, at some point during the MRI, they give you an injection that has colorant in it so they can get a better picture, I guess. And the lady, I have really small veins, and so the tech injected the colorant, but had to kind of dig around for a vein, which wasn't too bad, but she hit a nerve in my elbow, and so this entire, like, left side of my elbow was just one giant burning cramp for the entire rest of the MRI. It was horrible. She was very nice, though. But anyways, so they didn't find any MS lesions, so there is no indication of any MS. My blood panels came back today as well. It is clear. They tested me for everything under the sun they could think of. They tested my thyroid, for lupus, RA, Lyme disease. They tested for the B12 deficiency. They tested for everything up to spotted fever. All came back clean. She was like, you know, if I looked at your panels, I would assume you're a perfectly healthy adult. But since we know you're not a perfectly healthy adult, we're going to figure out what's going on. So, however, something did show up on my MRI. I apparently have a sort of rare brain malformation, which may be causing the bulk of my symptoms. It is called Chiari malformation, I guess. It's basically, okay, so there are these sacs at the bottom of your brain, and what happens is, a Chiari malformation is when those sacs are lower hanging, and so they actually protrude into your, basically they're crowding the top of my spine. She called them, she was very reluctant to give me much information about it, because neurology is not her field. She is just a primary care physician, or my doctor who gave me the results. So she was very hesitant to give me much information about it. All she would say was that it was, I had, she explained, of course, what she called them cerebral tonsils. And she explained what they were, and she said that mine were lower hanging than normal. I used the dubious power of Google and just Googled exactly what she said, low-hanging cerebral tonsils, and Chiari is what came up. It was the only thing that came up. It's literally what happens when those are lower hanging, is it's a malformation. So, now I'm not saying that that is definitively what my diagnosis is going to be. It's definitely there. Like, I have the Chiari malformation regardless. However, I am hesitant to say that that is what's wrong. I mean, obviously it's there, and I'm sure it's, you know, doing its own little bit, but until I see the neurologist again, we can't say for sure if that is what's wrong, because of course, you know, you can have multiple, conditions at once, but she was like, you know, all your other panels are coming back normal. So, turns out I have a rare brain malformation, guys. So, special snowflake. As much as a dubious achievement that is. But, anyways, the main concern with a Chiari malformation is, it can actually, and may have already, caused cysts on my spinal cord, which can explain a lot of the symptoms I'm having. Now, we don't know for sure if I have cysts. The cysts are basically caused from the malformation choking off cerebral spinal fluid. Even sitting here holding the camera phone like this is making me feel very tense and painful almost in my shoulders and in the back of my head and neck. We don't know if it's progressed to the point where I have spinal cysts yet. They're called something weird. It almost reminds me of the word sphinx, but it's not. It's got an S, a P, and an X in there, but I couldn't really quite tell how they were pronouncing it. I'm a very phonetic speller, so I don't want to try and say it and sound like an idiot because I'm saying it wrong. But, anyways, so, no MS, so that's a positive, I guess. But, we don't know if I have cysts yet. I will have to go back to the neurologist and get more MRIs done. They'll probably have to do an MRI of my full spinal cord. They'll probably want to do some more skull, or some more brain MRIs as well. I was originally supposed to go into the neurologist in July, but my doctor told me today that she is going to call the neurologist first thing Monday morning and try and get her to take me in as soon as they can fit me in. Because if there are cysts on my spinal cord already, they're only going to get worse the longer that they go untreated. And that's the thing about Chiari malformations, is that the longer they go undiagnosed and untreated, the worse they're going to be. So, and the more cysts can form, and so they want to get me in as soon as possible. I'm still kind of, like, processing it all, really. That's why I'm kind of having a hard time deciding what to say, I guess. I'm still, like, I just found all of this out at about 5 hours ago. So I'm still really trying to process it all and figure out, basically incorporate it into, you know, what I know about myself and my life, and how I'm going to move forward from here. I'm still trying to make sense of it all. Oddly enough, I feel a little weirder about this than I did about the prospect of having MS. So, I don't know why. I don't know why it's any different, but this wigs me out a little bit more. I don't know why. It just does. But, I'm still trying to figure out, you know, what this is going to mean for me on a larger scale. I'm still having a lot of fatigue. I'm still having some mobility problems. I've been deeply considering. Lauren has been trying to convince me to go ahead and invest in a walker, because I'm having a little bit of trouble getting around the house on bad days. Even on moderately good days, I get out of breath walking between the kitchen and the living room. So she is trying to convince me to get a walker, which I'm actually really, really thinking about. I want to kind of see what my doctor suggests first, since it's probably going to be a little while before they're able to get me in with the neurologist. You know, how I can mediate my symptoms in the meantime. I'm already having to use a wheelchair in a lot of stores. If we're going to be in there for more than 10 minutes, I use a wheelchair, because I literally do not have the energy to walk around stores anymore. So, it's whatever's going on, whether it's the Chiari malformation or something else that's contributing to it, is really affecting my daily life, and so I'm just looking at this point for a little relief. So, I wish I had thought to ask her about it this afternoon, but I was just so surprised, I guess. And I understand why she wouldn't give me why she was so hesitant to give me more information about it. You know, again, she's not a neurologist, she's not a neurosurgeon, so it would be almost kind of irresponsible to tell me, okay, this is what you have, without consulting a neurologist first. I mean, she can look at the MRI results and tell me essentially what they say, but she can't give me an official diagnosis, because that's not her field. So I actually really appreciate that about her. I appreciate the fact that she is very open about when she's out of her depth. Especially when it comes to something like a Chiari malformation, because the treatment for it's kind of serious. Basically, the best treatment they have for it is to cut open the back of your skull and basically shave out pieces of your bone to make room for the malformation, so it's being squeezed less. They basically want to make room for that spinal fluid to get in around it. And so, I mean, the treatment, that's the best treatment they have for it, is brain surgery. Well, I guess I can't call it brain surgery, but your brain is still exposed. They will oftentimes go in and add a little bit of, like, an extra pocket, or like a little bit of extra tissue, to give it a little pocket, to give it even more room for the spinal fluid to get around it. So, yeah, that's the best treatment they've got for it. Either that, or to just leave it alone. And depending on your symptoms, that might not be feasible for you. We've yet to kind of discuss what this is going to mean for my symptoms. Again, we're not even really sure if the Chiari is entirely responsible for all of my symptoms. It's a work in progress. So, I guess I'll be tracking that as well. I should probably do an autistic actuality video tomorrow. I feel like it's been a little while since I did one. So anyways, I'm going to leave it here because this video is already a little longer than I expected it to be. And I really have to get to bed. So I will talk to you guys tomorrow. Maybe have a little bit of footage from the baby registry thing. We'll see. But anyways, I will see you guys tomorrow. Bye!